started here. Thank you all so much for attending today's office hours. We have been through a period of time where we were talking about the abstract in full detail. Today, it's going to be a bit more informal. We're really here to help with any technical assistance and support and provide guidance toward the application itself. Here's the agenda. We're going to go through a bit of a recap of what we've discussed in previous webinars, just for some reminders of things that could have been missed or things that people need clarification on. We'll walk through the application together. So there'll be some times where we are able to look at the application in its fullness and see any questions that you all might have. We'll also have our application submission refresher. So we'll talk about the abstract again, the elements of the abstract and what APHA expects, as well as some FAQs that Nira will help lead in understanding what we would need for those submissions. We'll have breakout rooms, but they will be optional. We really want to have this as informal as possible. So if you all have intimate questions that are needed for personal contact from us, we're happy to break out in rooms and have those conversations. Or we can also have a way of collaborating in the main room. So as the presentation is going on, we'll gauge what you all want and need to experience. But in the meantime, if you have any questions, please feel free to drop them in the chat. We have Raya, we have Angie and Nira here as our support system around this work. So if there is something that you all have as far as questions, we'll be watching the chat and seeing if we can respond as quickly as we can. And then to end, we will have some application submission reminders, just so everyone feels comfortable about what the process looks like moving forward. And so the annual meeting is why we're all here, right? And so it's going to be an exciting time. Registration has opened today. We're really excited about what's to come for the meeting. And so as a reminder, November 12th through the 15th in Atlanta, where I'm actually at right now, we will have the meeting and we'll be hosting you all. Also looking at the actual topic itself, which is creating the healthiest nation, overcoming social and ethical challenges. So as you all are in your host site experiences, thinking about some of those social and ethical challenges, it'll be really interesting to hear what you all have been doing during your experience. Just as a reminder of what the conference entails, there's going to be a welcome session with keynote speakers and other affiliated speakers, as well as plenty of networking opportunities, which we will provide some guidance and some tips along the way of how you all can network together as a family. Also, the poster session is where you all will shine bright. So when we submit the abstracts in the application portal, you will be able to actually put that abstract on your poster and allow it to speak for itself once you are attending the conference. And then there's also plenty of sessions in between those times where you're doing your poster session. As a wraparound, there are sessions that are dealing with a lot of different topics. So we'll be able to, together, once the submission period closes for applications and we know who the cohort is, we'll be providing extra technical assistance and support all through November, so you all can have a way of understanding what the sessions might be like, what the poster experience is, and much more. So stay tuned. So now we're going to talk through the actual application submission process. Raya is dropping some application links in there from our Fern page, so please feel free to check it out as I'm speaking or just on your own time. As a reminder, the application submission is due June 12th. We will be reviewing applications between the first week of July, the 3rd and the 7th, and we'll be able to report back to the awardees upon that time. The application scholarship will cover attendance to the conference, travel to and from, food, ground transportation, and there's probably a couple of other things that might squeeze in depending on what the travel time looks like, but we will have all those things allotted for you all upon being awarded. And the good news is that the application is live, released, and ready for you all to submit. So at this time, I will be able to show you all what the application actually looks like and step-by-step on how to submit. So I'm going to exit out of my screen and show you all the actual application itself. Thumbs up if you all can see it well, if everything looks good on your end, would appreciate that. Thanks, Raya. So we have the APHA application here, and it is going to, like I said, be submitted a deadline of July 12th. We have a couple of timelines here for you all to see in clearness what is expected of you. As I mentioned before, once we have the awardee cohort, we will provide ongoing technical assistance and support throughout the duration of the time that you all will be with us until November 11th. And then on the 12th through the 15th is when the actual magic happens. So during that time, we'll be able to support you all. About 20 to 30 applicants we're looking and expecting for the annual meeting. And as I mentioned before, the meeting registration will be covered, as well as some hotel stays, transportation to and from, travel, ground transportation. So there's going to be different things that will be offered to you all as you're attending the conference. For the submission, we have a couple of questions. The main star of the application is the abstract itself. We really want you all to be able to talk through your host site experience, talk about the introduction, the project description, some lessons learned from the experience, and recommendations for future professionals. And so those elements we'll talk about in our office hours on the next slides, but just for you all to continuously think about what's expected of you and how you can actually enter that in the application itself. And so some requirements, as you all can see, it's for AmeriCorps Public Health members and professionals who are affiliated with APHA. So as you all are thinking about what your affiliation is, if you want to continue through APHA, or how you want to be connected to APHA outside of AmeriCorps, we'll talk about that too. But the main thing is that all AmeriCorps Public Health members are welcome to apply. And so as you can see, we're going to do a preview of the application. But if you wanted to actually do an application yourself, I'll do a sign in for you all, and you all can see a bit of the process. And I'll start with mine, and then we can go from there for you all to see what that looks like. It might need to be verified, but for the meantime, I'm going to do a preview so you all can see what the application looks like itself. And so for the preview, there's going to be some general information that's going to be asked of you, contact information. Some of this information is, if you are awarded, we would love to have information to know where your travels will be to and from. So this is good for our records as well. We also have gender, race, ethnicity, and all of these things are preference. So if you prefer not to respond, please feel free. And then we also have you ever attended an APHA meeting, webinar, or event, just for us to know if you've been in participation and in relationship with us. Also age group, and if there's any other scholarships you've received, like NACHO's 360 conference in July or anything that we should know about, we'll have this question here, but we will consider all applications. Moving into the requirements, we have some educational history, as well as some public health interests. So as you're attending the conference, as I mentioned before, it's going to be tons of sessions, and we'd like to know a little bit about what your interests are beforehand, before we actually have the applicants apply. So we also have other, just in case there might be some other interests that you all might have. And then some public health skill sets here, some here, but if there are other skill sets that you have, there's the other the other box, so you all can type in a skill set that you all are interested in building during the annual meeting. And then we have one essay question before the abstract, and this is really to help us get to know you all a bit better when it comes to your personal and professional aspirations, and why the annual conference is important to you, and what it will do to advance your placement in the professional world. So this question is also 250 words. It should be quick and easy, but it does help us understand you a lot better and get to know you as an applicant. Then moving into about your project, we want to know a bit about your host site and where you're serving and who your supervisor is. So all of those elements will be here. Is it an email that you have from your supervisor? Please let us know, or try to get in contact with your supervisor to where we know that information. And also, you all are doing a lot in your host sites as far as different interventions and different styles. So we want to know a bit about what interventions most align with the work you're doing currently. If there is something different that you identify with, please share in the other box. We'd love to see what interventions there are available. And then the communities you serve. We have a lot of descriptors here, but if there is something different, we'd love to see it in the boxes here. So we have, if there's a different community that you're speaking with or interacting with, we have these boxes here just in case. And please, as you're looking at this through the chat, shout things out. I'm always happy to stop and make sure that everybody's okay with the process. And then here we have the actual abstract submission itself. So these text boxes are here. Just to let you know beforehand, it's always helpful to type these things in Word documents. You can save, you can edit, you can do all the things before actually copying and pasting it to the application itself. So just something that could be helpful for you all. But the abstract submission box is here. 250 words is the limit, but we're giving 300 words because you all have to include a title for your abstract. So we're thinking about those things too, but try to keep it in between 250 words and 300 words for your submission. And we'll talk about the elements as I mentioned before, but just in case, we did add the element here for your review. And then we also have the acceptance. So we just wanted to add this in to ensure that you all understand the expectation and understanding the in-person events and activities that is expected upon being an applicant and if you're awarded. So just typing your full name below will add this digital signature for you all. So this is the application. It's in full effect. Raya was able to drop that in the chat. Just in case you all want to see it in its full color, the front page starts here where it talks about your guide to success in the annual conference and expo. As you can see, it talks about what the opportunity is, a bit more about the earn opportunity, and then the actual annual meeting itself. It goes into detail about where the annual meeting is, why you should attend, what the benefits are presenting, and the actual scholarship itself. As you can see here, we have two ways of applying. One is in the parentheses here, and then the one that probably most would see is here in the the green sticker here where it says apply here. Also, we have more information about what an abstract is in case you all need more detailed information. And then we have a couple of external resources for you all, well as the 3 webinars that we have been hosting with you all during this experience. They're all here, clickable, ready for use. That is the page, and hopefully that is really good information for you all to gather. We'll go through this a bit more in just some abstract FAQs, but as you all are thinking and having questions, like I said, we're always here to answer them. So please put in the chat what you all feel and need for your process. I'll continue to share my screen. And so just as a recap, we're going to talk about what an abstract is. So as I mentioned in the previous webinar, the abstract is the commercial. It's the trailer to your movie or your poster, right? So the abstract really helps people understand what you are presenting, what you are doing in a snapshot view. In a way, it helps to understand what the summary is in a concise way of the paper, poster, or oral presentation that you're presenting on, in this case, the poster presentation. And so what is it that's interesting about your host site experience? What are you going to talk about? These things and elements are going to be put into your abstract. And then knowing the audience interests, which there's going to be a lot of public health professionals in the building and other professionals that are working in public health spaces, they're going to want to know a lot about what AmeriCorps is and the work you all are doing. And so making it connect to the audience that you're working with is going to be really impactful as well. And so we talked about a couple of these elements before, but just as a reminder, because you all are talking about your whole site experience, you're going to be talking about a short summary of some of the issues or most likely an introduction. So this really talks about what you're doing at the whole site, why it matters to the overall scope of the public health industry. As well as a description of the project, and then the kind of service that you're orienting. Some lessons learned. I'm sure you all have been learning a lot during this experience, and so we want to know a lot about what those lessons are, as well as what are some recommendations. What would you recommend for the next Public Health AmeriCorps? What would you recommend for the next public health professional or entry-level professional? Some of these things are going to be really valuable to your abstract, and so adding those elements in is going to be great. I'm going to turn it over to Manira. We had a couple of FAQs, and so she'll help us get through them one by one.
Hi, thank you, Christy. Just a couple of questions that we think are coming up as y'all write your abstracts. Hopefully you've started to think about them. If not, you've started writing them, but a couple questions we'll go through. So one question we think we'd like to talk about is, is this a good topic? I have said this before, I want to reiterate it again. The work that you're doing at your sites is really important. So if you're writing about the work that you're doing, yes, it's a good topic. When you think about how to present it, we'd encourage you to think especially about the impacts and lessons that you're learning through your work. And again, we've talked about these 4 elements, but as you're deciding on a topic, which we've done, but you've still got some time, think about your activities, your audience, your impact. So why are you doing it? And lessons learned, how could this inform other projects? I will add here, we know that some of y'all might just be starting on your AmeriCorps journey. So if you don't necessarily know what the impacts are going to be, that's okay. But you can talk about the projected impacts. So for example, when I was in a program, not unlike this one, I was working on arthritis and we were doing a prevention program and we just kind of started it. So we said we anticipate that X, Y, and Z will happen. And then hopefully by the time the conference comes around in November, you'll have more information to share. So is this a good topic? Generally, right about what you're working on? The answer is yes. Next slide, please, Christy. Thank you. Okay. So Christy's actually addressed this already, so I won't go into it too much. So what should I put in my abstract? As Christy said, it's like a trailer, it's a teaser for the main poster presentation. It'll contain background info, gentle questions, or kind of tell us like what the problem is, what you did, why, and summarize your findings. The suggested sections that we have discussed are an introduction, a project description, lessons learned, and recommendations for future professionals. Again, if you have not gotten to the point where you have learned your lessons, you can talk about what you are learning, what you anticipate to learn, etc. Next slide. Okay, I think this is our last kind of general FAQ. Is my abstract good? Y'all might be worried about this. If you're here, if you're coming to all of these calls, we know you're excited. So I would be really confident about the work that you're doing. But if you're looking for a little bit more information about how we will evaluate your abstracts, here are 4 elements that abstracts generally are encouraged to look at and that we'll look at as well through the evaluation process. So they call them the 4 C's of abstract writing. There's a link down here to UC Davis that has some information on it, but it's pretty much anywhere. Look at your abstract and think about, is it clear? So as reviewers, we might not know what you're doing at your host sites. So can you kind of remove yourself from your host site? Will someone be able to understand what you're doing? Is it concise? So this is probably the biggest challenge, at least for me, with an abstract. It is about 250 words. So trying to pull the most important information concisely to present in your abstract. Is it complete? So for example, if I, again, am working on that arthritis project and I'm writing about it, you might have some questions about like, okay, well, who's the audience, that type of thing. So I'm trying to make sure that you're giving us the full picture. And lastly, is it cohesive? Does the problem statement relate to the activities that you're doing? Can I kind of track the logic about what you're writing about? So those are the 4 C's that we recommend you take a look at as you write your abstract and will be a part of the evaluation process on the reviewer end. So I think that is it for commonly asked questions. Hopefully this is helpful to you, and we'll turn it back over to Christy.
Thanks, Manira. That was really helpful. Appreciate you. Moving on to the submission. So as I mentioned before, Microsoft Word is going to be your best friend when you are drafting and thinking about your topics and playing around with words and sentences. So make sure that you have some time allotted to do that in Word and then copy and paste in the submission, the application. And then 250 words is the goal. Of course, we allotted 300 because there are titles and other elements of the abstract, but short, sweet, and to the point is always going to be your go-to. And so also we had some frequently asked questions about, I'm a little nervous about presenting. This is something I've never done before. This is new. How do I build that confidence, right? How do I know if my abstract is good enough? How do I know if I can actually do a poster? Number one, that's why we're here. And number two, that's why we have a couple of tips for you in case that could come up in your psyche. So some confidence building tips. Number one, that you know your work better than anyone else, right? So when you are performing at your host site, when you're doing great work, when you are writing the abstracts and kind of coming up with ideas and strategies, you are the master of your own work. And so you know it better than anyone else. We are just here on the outside looking in. And so be confident and prepared to know that you are in the midst of this experience. And we believe that what you're doing is very impactful. And so we want to read more about it, hear more about it, and get to know you in the process. So that's the whole goal. And it's okay to not have all the answers. So if you are awarded and you're standing in front of your poster, and people might ask you very detailed, deep related questions, and you might say, you know what, I actually don't know. And that's okay, right? I don't know how many times I probably said I don't know in my life, but I can tell you it's been a lot. And I've been confident to know that if I don't know, I'm going to make sure that I find the answer somehow, some way. And so that's okay even for you when you're presenting. Be confident in knowing that you know what's on your poster and you know your experience, and that is more than enough. APHA's meeting will be filled with folks very new to the field, just like you. So you're not alone, and there's going to be lots of people that are just interested in knowing more about you and why you were interested in joining AmeriCorps. AmeriCorps is such a personal and relevant experience, especially in this time in the public health world. So you all are very critical to what we do. And people just really want to know more about that, as well as what you performed at with your host sites. And then practice, practice, practice. Practice doesn't always make perfect, but practice definitely makes better. And so the better that you get at it, the more you'll feel confident in presenting what people might ask during your poster session. So practicing in front of mirrors with friends or with colleagues is going to be your best bet. And then there's also a couple of tips that we have here, just in case you all want to look into this more deeply. But I will say, if you Google confidence tips on Google, there's a ton of things that come up. But honestly, the best confidence is knowing that you are the master of your own work. And so hopefully this is helpful for you all. And I believe that you all will do excellent in all the avenues that you experience during this time. So I do want to say that breakout rooms can be optional at this time. We do have a couple of people in the room, which I love to see. But if we want to just talk on the main stage about any questions or relevant that comes to mind, we can talk amongst it together, help brainstorm abstract ideas together, even share knowledge. So considering that we have about 9 participants, the 8 participants here in the room, we can stick to the main stage. If there are any questions that you all might have, I can look through the chat, see if there's anything that I missed. But it looks like there's none that I see at this time, but if you all feel comfortable asking away, please do, or type something in the chat. Yes, Stephen has a question. Stephen, go ahead.
Hey, can everyone hear me?
Yeah, loud and clear.
Yes. So I was wondering because I knew that the abstract was due on the 9th, and I was also I guess originally trying to use my proposal that I was submitting to the AmeriCorps that's due on the 7th. Basically, so I was trying to build or at least get the community garden or whatever, where it was the community garden that was a medicinal garden because it was adjacent to the ER. And I found some plants and stuff over that was that gave you COVID resistance amongst other things.
So Stephen, just so I can be clear what you're asking, you wanting to make sure that the abstract, the application itself is due on June 12th. Is that what you
No,
want to
I'm
make
saying
sure?
because I know the abstract is like the it's like a thesis, right?
Yes, well, so the abstract is much shorter than a thesis, right? Let's just go back really quickly so I can talk through the elements one more time. So with the abstract, and Ryan, if you could find a quick example online so I can click it in the link and show them. An abstract is a paragraph of 250 words that describe what you're doing at your host site. Why is it important to the public health field? What lessons you're learning from that host site experience? And what recommendations would you partake on the next public health professional or health professional? So I'm going to quickly just talk through this a bit more, Stephen, for your understanding. So because you're at a host site, right? Let's just say right now you are working on urban farming. You're helping farmers produce better food on their land. If you're doing something like that, let's just say, I'm just kind of giving an invisible topic here. If you're helping farmers produce better produce on their land and looking at agriculture and climate or those kind of elements, and maybe you're helping the farmer with producing a produce list, maybe you're helping them with evaluating how well their food is producing every season. Let's just say you have a project like that. The abstract will describe why urban farming is so important to public health, what the actual project is doing. So what are you doing while you're helping these farmers? What lessons are you learning while you're helping these farmers? Are you learning that there needs to be more produce that is distributed during the summer seasons because of how it's transported? Are you learning that as a personal AmeriCorps professional, now you understand the importance of farming versus buying things in stores? What lessons are you personally gaining from your project? And then recommendations. What would you carry on to the next person? So do you recommend that farmers need to have a better system in place so that they can produce mass produce? Do you recommend that there needs to be an evaluation plan so the farmers can know what season is best to actually farm? These kind of things you're going to be asking yourself as you're doing your host site experience. And like I said, that's just an example, but whatever you're doing in your host site, you are looking at it in the broader scope of how is this important to public health? If I'm working with a clinic that is doing COVID research, why is that important to public health? What does that mean? If you're doing something in a clinic with COVID research, what would you describe that as? What does your day-to-day look like, right? What lessons are you learning? What patients are you interacting with? What recommendations would you give for people who might be in your shoes one day? So that's the idea when you're thinking about your abstract and how you're formulating it. And I really hope that helps, Stephen. And you can give me a thumbs up or type in the chat if it does. But that's kind of the idea of what we're doing when we're thinking about the abstract submission. Thanks, Stephen, for that. And thank you for some questions in the chat. I do see that Ryan and Angie have been using the chat to help people out. So really do appreciate that. Are there any other questions that I need to bring up that I've missed, or maybe Raya, Angie, or Munir, if you have any other things to discuss during this time as well?
Yeah, it sounds like, if I'm understanding correctly, it sounds like there's two questions in the chat that are similar in content, and maybe I'm misunderstanding them, so please correct me. It looks like one question from Marcel and one question from Madeline. But essentially the abstract itself should be related to or about, I guess, the work that you're doing with Public Health AmeriCorps through your Public Health AmeriCorps program. So you don't necessarily in the abstract itself need to define that. We'll just know that that's a part of the work that you're demonstrating to us in the abstract. I don't know if that answers the question or if there's anything else we should provide in terms of guidance there.
Thanks.
That makes sense. Thank you. Yeah, I have like a draft written and it describes all about the project I'm doing at my host site. I just didn't explicitly say in there anywhere, hey, I'm an AmeriCorps member doing this. So I just didn't know if I needed to note that or not.
Perfect. Thanks for clarifying. Yeah, no, you don't need to make that explicitly clear. There are other aspects of the application where we'll gather that information, including like your host site supervisor and host site name and all of that stuff. So that should be taken care of. But thanks for checking there.
Well, and I was just jumping in. I mean, if it helps to say something really easy, like as part of a host site for Public Health AmeriCorps, something like, you know, my role, but I think Raya's right. You don't have to do a whole lot, but just if that helps to set the context for your position, that's great too.
Thank you all. And I did notice that I do have an example of one of the presentations with an abstract. So I'm gonna exit out of my screen really quickly and see if I can show you all this example so it can kind of give you a visual picture of what I'm talking about.
And while you're doing that, I just remembered, Christy, that we had another question about other requirements. Hopefully that's been answered based on the fact that we reviewed the application live. So you all know all of the questions that'll be on the application, but we will not be asking for your GPA or academic, well, anything related to your academics or anything like that. So we won't be evaluating GPA, which was a question that we received in the pre-registration.
Thanks so much, Raya. I'm going to quickly jump to the abstract example that we had in the previous webinar. You all can see a bit of what we are talking about. As you can see here, there's an abstract example of workforce transition that includes COVID-related issues. So this abstract is talking about during COVID, how were people able to transition in and out of the workforce? And so as you see, it's laid out here that there are the actual issues of how COVID and its related work changed the workforce and its training mechanisms, as well as some descriptors of what the actual experience was. So they're about 2 to 3 sentences for each section, but it really does have a way of capturing all of the elements that we're looking for. Some of the lessons learned about what it looks like when it comes to continual job seeking and also a demanding workload during COVID, and some recommendations of what they would pass on to the next person. So emphasizing additional career pathways in public health, higher paid roles and opportunities for people to expand their experiences in public health. So, like I said, a few sentences in each section, but it does describe a bit what the issues are, what the descriptors are during the project itself, what lessons they've learned, and what they'll recommend for the next person. Hopefully this is a very great visual example for you all in case you weren't attending the last webinar, but this is some things that we have looked at and a great example of what we're expecting and looking for. I will jump back over to my slides and we will continue to push forward. Are there any other questions, comments, or related concerns that
Yeah.
we already discussed? Yeah.
Can you guys hear me?
Yes.
So I've seen like the abstract. So there's a little like variation or difference between the abstract I saw you guys want and the traditional, like how the traditional abstract looks. So the traditional abstract, you have introduction, you have like your method, you have like your brief like results, and you have discussions. And so this one is in another format. So you guys like prefer like your layout to be like the one you like saw like just recent.
Yeah, great question, Omar. We had this layout of introduction, description, lessons learned, recommendations, because the other abstract that you described is more of a scientific abstract. So when we look at introduction, methods, results, and discussion/conclusion, those are usually things that have been happening during a long period of time and involve some type of research element or component. Because you all are doing something at a project host site, there's more of a project description attached, more so than methods or methodology. The lessons learned is something that will really relate to your personal experience in the work and what you recommend for future professionals. And so there are different elements of the abstract. You're right, there is a scientific abstract that you might see most common in papers and other APHA presentations. But for the sake of this experience that you all are having, because there's no scientific elements or research attached or aligned, or at least not yet, we really want to know more about the description of the project, what you all are personally doing in that experience, and what you're gaining from it.
Yep, thank you.
Of course.
I'll jump in to add. So obviously the advice that we're giving y'all is general. So Omar, if anybody, if you are doing a project where you are doing that very kind of specific scientific research, then totally feel free to use the type of abstract that works best for you. This is general, advice.
Thanks, Manira. And you're right, because if there are some scientific elements or there have been some research performed at your project site, then we would love to know what that looks like. And so you can add those elements in if it's more of a scientifically aligned abstract. Any other questions? Any other thoughts? We had some great questions today, so I love that you all are participating, being active. I'll just click forward here. So I'll recap really quickly and just see if there's any other things that pop up. As a reminder, the application is due June 12th, 11:59 p.m. So you guys have this week and the weekend and also Monday, all of Monday to have that in for us so we can review it. We have an internal rubric that we use to grade, but we're really just looking at the different elements of the abstract and how it aligns with what we're looking for. Also, we'll know within the first week of July who the awardees are, and we'll be able to communicate that to the awardee cohort. And we're looking at about 20 to 30 people that we will be accepting for the scholarship. Raya dropped the Fern application link once again, just in case you all missed it the first time. But I really hope that this was helpful. I really hope that this was engaging and that you all have a much better understanding of the process. Like I mentioned before, we'll be keeping an eye out for those application submissions coming in. If there are any type of questions involving technical assistance or anything that you all need, I'm going to throw in my APHA email in the chat. Please feel free to message me email me what you need, what you have questions about during your process of applying. I will be happy to answer anything that you all have. One more round for anyone who might have questions, any lingering thoughts? Malini, anything? Okay, you came off mute, just making sure. All right.
No, I'm okay. Thank you.
Okay,
Thank you for
perfect.
the information.
Absolutely, absolutely. Thank you all. If there's nothing else, I will conclude. Manira, Raya, Angie, if there's nothing else that you all have, thank you all so much for being participants in today's office hours. I hope it was helpful. I hope that you all feel confident and equipped to do all the things for the application. And I did drop my email in the chat. Please feel free to message me in case anything comes up. Thanks, Omar. Thank you all so much.
Thanks, everyone.